Fiona came to a post in January 2010. At that time, the dialysis access service was not really fit for purpose, and we needed some development. In addition to that, we had national standards which had just come out, which said that we had to highlight less than 20% of patients on temporary dialysis access. So basically, one of Rona's remits was to streamline the dialysis access service with one-stop clinics for new referrals for access, to monitor existing access and for deterioration. And one of the main things that she's achieved in her time is that she's reduced the temporary dialysis access rate from 38% to 27%, which is an enormous achievement. Having an established dialysis access or fistula is much safer. There's less infection risk because they haven't got a foreign body in place, and actually it's a generally accepted safer method of treatment through the dialysis access. Temporary access always has inherent risks with infection or clotting, or actually there is a risk that they can actually come out. Bona's a highly motivated individual. She also is very good at, has been very good at benchmarking where the existing state of service was and identifying where it should be in the future. She's got some, very good leadership skills, which has helped her to engage with the link nurses in all the dialysis units to actually deliver this service in a better way.
Jackie came to rheumatology 8 years ago. She came with no experience at all, so she had to go through a period of training in-house. She has learned injection techniques. She's become a nurse prescriber. She sits on the Trust Records Committee. She has also been an implementation manager for our software program for drug monitoring. Well, Jackie identified the need for ultrasound of the hands and wrists, which has very much become part of the assessment of patients with early arthritis and also whether they've gone into remission or not. Having identified it, she then sought out someone who would train her within the hospital. This meant crossing a number of professional barriers, which she managed to negotiate very successfully. Having started her training, she then produced a specification for the ultrasound machine she needed. She then procured it through funding from sources within the charitable donation field, and then started up the clinic with me. We run a clinic once a week where she is in the room next to me. I see the new patients with potential early inflammatory arthritis. They then go to her for a scan, return to me for a decision on diagnosis as to whether they then go on to a program of intensive treatment for their arthritis, or whether indeed they don't have an inflammatory arthritis and then discharge the GP. Jackie is one of the few, if any, other nurses exist who actually do this service, so it is breaking the boundaries, and this clinic has been instituted and has been very successful and has been recognised as such by the patients who are going through the process.
Gemma has been totally instrumental in the whole of the delivery of the hospital at home. It's a new innovation, it's going incredibly well. Patient satisfaction is always 100%. We've had patients that have even written to the Prime Minister because they're so pleased with the service. She started with the business case, which she worked very closely with Heather Munro on. She presented the business case and took it forward. She also manages the vascular IV access, which again she's instigated herself with the help of Matt Jones. She is a true leader. I mean, I think a lot of people can manage, but not many people can lead. And Gemma has got that special little something, that X factor. She is so focused on what she does. She's a true innovator. She's always looking at new ideas and how to take her services forward. She's a pleasure to work with. She's a fantastic leader. People listen to her, she communicates, and I can't ask for anything more in a matron. She is absolutely fantastic. I think they broke the mould when they made Gemma. People like Gemma is what the NHS need, a true innovator.